Hi, I'm Dr. Jonathan Craighead, and this is a short video with a few reminders to help you with your recovery after hip replacement surgery. It is not uncommon the first few days after surgery to get dizzy or lightheaded when you first stand up. It's important when you sit and stand up that you do so slowly and have your walker with you. I would also recommend having a family or friend nearby when you first try and stand. It's also important to ice the hip after the surgery. We recommend that you use a Ziploc bag of ice or some frozen vegetables on the hip 30 to 40 minutes, 4 to 5 times a day. Your physical therapist should be coming to the house to work with you. They should come twice a week for the first 1 to 2 weeks. If you've not heard from your physical therapist, please let us know. It's also important to work on swelling in your legs. We recommend that you wear the compression stockings during the day for the first 4 weeks afterwards. You may take them off at night and you may wash them. The numbing medicine in your hip will usually wear off 12 to 48 hours after your surgery. When this happens, the hip may be a little bit more sore. We've called in some pain medicine for you that we hope for you to take. If you're not allergic, please take the Tylenol every 6 hours whether you're hurting or not. We've also sent in some Tramadol, unless you're allergic to it, that you may take every 4 hours as needed if the Tylenol is not controlling your pain. We will also give you oxycodone or another narcotic that you may take 2 hours after the Tramadol if you're still hurting. You may alternate the Tramadol and narcotic pain medicine every 2 hours as needed. If for whatever reason this is not controlling your pain or you have any issues with the medicine, please let us know. The pain medicine can be a little constipating, and we recommend that you drink plenty of fluids and take a stool softener. Also, we recommend that you taking the pain medicine with some food. It can cause some nausea if you take it on an empty stomach. We've also sent in Zofran for you, which is an anti-nausea medicine you may take as needed. You will have a waterproof dressing over your hip. You need to leave this dressing on until you return to our clinic. You can shower with this dressing, but we would ask that you not soak the hip in a pool or tub. It's not uncommon to have a little bloody drainage the first few days after surgery. As long as the blood's not running out from underneath the dressing, you do not need to worry. If the blood is running out from underneath the dressing, please reinforce it and contact our office or the physician on call. You do not need to go to the emergency room. Just let us know what you're having difficulty with. The first few days after surgery, it's important to keep well hydrated and eat properly. If you're not taking a multivitamin, we would recommend that you do so. You may move around the house comfortably and do the stretching exercises given to you by the therapist, but we would ask that you not overdo it. If you have not been given a follow-up appointment with my office, please contact us immediately. We would like to see you back approximately 2 weeks after the surgery. Once again, it's important to us that you feel comfortable and have a good experience. If you have any questions or concerns, please do not hesitate to contact us.